What's going on, everybody? Welcome to another episode of Untamed Opinion. I am joined by registered nurse Manny Conejeros. He attended Medical School, graduated in 2009 with a Bachelor's of Science in Nursing. So he's been doing this for quite some time here since 2009 for 11 years. That's pretty cool. He's worked in different departments like critical, ER, ICU. He's worked in South Florida, Arkansas, New York. He's now in California. He's worked in Seattle. So he's working all over the place in various hospitals. So I appreciate you taking your time and talking to me about this subject
Yeah, it's great to be here, untamed.
here.
So
Yeah, you like that, don't you?
yeah, it's catchy, man.
It's catchy. Well, I wanted to talk to you, from your experience, because right now you're in the hotbed zone. You're in LA right now, and you're working in the hospital. Your wife is also a nurse, a traveling nurse with you as well. She's worked in different departments along with you, uh, and she's been doing this probably just as long as you have, give or take. You guys. She worked up in the San Jose area right before you came to LA. Right
Right.
in the middle of this whole COVID-19 thing. Um, Thought you were a little crazy going out there, but do what you got to do. uh, so tell us, what has it been like? What has it been like working in a hospital that's mainly COVID-19 patients?
It's an eye opener, man. I never in my whole career, especially how we're like advertised a certain way, that you're gonna take care of patients. It's the betterment of humanity. It's better to take care of someone else, gives you perspective, that kind of thing. Never in my career I would have ever imagined working in such conditions. Like on a daily basis, when I start working in a coronavirus unit, I have to be gowned from head to toe, head covering, glasses, goggles, and just wrapped in plastic, man, for 13 hours a day. Luckily, here in the state of California, there's laws where, at least in nursing, I'm not sure in other industries, but you're supposed to take a 15-minute break every so often, mandatory. Not like in other states they get by, but mandatory
Mhm.
with a 30-minute lunch. So if it wasn't for that, I'd probably be stuck in this unit for 13 hours straight without a break, without pee break, food break, whatever. But yeah, just working in those conditions for 5 hours at a time with like a 15-minute break is pretty tough. Sweating from head to toe, like a lot of the times, not always, but a lot of the times, and just taking care of very, very sick patients. So it's again, it's been just an eye-opening experience.
Well, that's crazy. But I know what you told me was that the PPE, the personal protection equipment out there in California, and the laws and the way they take care of nurses out there is pretty good out there in California.
Yeah, I mean, I can't speak to for other states or whatever. Like, I know there's been a lot of PPE shortages around, and I can't say there's PPE shortages in Los Angeles County alone. I could only speak to where I'm working,
Hmm.
but at least where I'm working, they have enough PPE and they're responsible with it. Where I come to work and I don't have to worry, oh man, there's not going to be a mask for me to wear, or goggles or anything. So at least the hospital where I work are very concerned with nurse safety and just employee safety, like in general, and they provide us with all the PPE that we need. So I'm blessed to have landed somewhere where they protect the nurses.
No, it's very good, especially working in a high risk, high exposure, and what you've been dealing with for 12, 13 hours a day, like you said. That's crazy. Uh, so you're working with coronavirus patients. You're in it knee deep. 3, 4, 5 days a week. You said you're working about 60 to 65 hours a week. That's absolutely insane, but that's what it needs to be right now, unfortunately, maybe because of nursing shortages or just too many patients coming around. Uh, what is key information you want people to know about the coronavirus? What is it that from your expertise, from your working with the patients, what is it you want them to know about coronavirus?
I think it's um, prudent to start the conversation of what is a virus anyway, because a lot of people have this generalization they can't see it, so it just must not exist. But like a virus is just like a capsule of protein that doesn't think; it just floats around in space and takes advantage of a situation. Like first of all, virus is smaller than bacteria, so it's like if a bacterial had eyes, they wouldn't even be able to see a virus. That's how small this thing is. That's why it's so um, N95 masks like are just enough for it to prevent transmission. Okay, that's why regular surgical masks or whatever it doesn't prevent it. Viruses are everywhere. We're breathing zillions of it an hour, a minute, but our body's defense systems are smart enough, and through inherited by our parents and through just growing up, that our bodies learn how to just defend through most viruses. This thing, the novel coronavirus, is the first time we've in humanity supposedly that we've been exposed to it. That's why our defenses are just all over the place. Okay. These capsules, these little protein capsules, that's all it is a little capsule made of protein. Inside of it is just a blueprint of information that just floats around in space, and outside of this capsule has little receptors like little keys, and our cells are the keyholes, so it just floats around. It makes its way inside mostly our noses and then our lungs, and then it just finds the right receptor to attach to, and then the cell, it could be like these receptors are what's called ACE receptors, and a lot of our cells have these receptors. So the coronavirus is not limited just to our lungs. At first, research is showing that it first inhabits like nostril like cells in our nostrils. Then they replicate from there, and then it just trickles down to the lungs. And the whole point of a virus, and that includes any virus, is just replication. That's all it does, man. So the information is like snuck into a cell. It replicates, and then it reproduces so many viruses inside the cell that it bursts, and then it kills the cell. So that's one way that we start getting sick or whatever. The second reason that we get so sick, and it's just random, we don't even know why a certain population gets sick, but it could be like genetics, just our blood type. It could be anything, man. There's so many different variables in this that the second injury that we face when we contract coronavirus is what was called a cytokine storm, where our body overproduces too much of this defense mechanism that we have already, and it like over exaggerates this like inflammatory response, which naturally is a defense mechanism. Like you get hit in the arm, your arm swells up to control bleeding and whatever, and then the swelling goes away. But imagine this overreaction of a defense mechanism that we normally have in our bodies that starts doing damage, especially to lungs, to livers, kidneys, our heart. It damages the vessels inside our blood, like our arteries and veins. And what we're finding out now versus, I don't know, 2-3 months ago, is that a lot of patients also, it's not just lung injury that's facing. It is strokes and heart attacks from damage to the lining of our vessels that starts breaking away blood clots and traveling to our heart and our brains.
So with all that,
So
how come the coronavirus tends to hit people harder versus others, whether it's age? And right now it doesn't seem to be like it's okay. It really affected the older crowd. Now we're seeing a lot of younger crowd being affected and whatnot. So what is it? Do any of these patients have to have an underlying condition, or can somebody completely healthy, like I am, like I feel, that doesn't have any underlying issues, if I were to get it, I may not know it. So why is it affecting differently amongst other people?
We don't know. There's a theory out there. It could be blood type. O positive is even though it's the most common blood type, it's like one of the defining factors of not the disease process not taking over the body and us getting really, really sick from. So that could be a theory. I don't, but overall, generally, we don't know. It's just more prevalent, or it's more obvious, I should say, and in the older population, because the older we get, the more issues we come with to the hospital, and that it doesn't matter if it's like a coronavirus or it could be a heart attack, any little thing like the more comorbidities that we call it in the business that you have coming into the hospital, the, the, the slightest injury could be catastrophic. But the younger we are, we have less comorbidities, so we're more resilient to an injury. We have more bodily resources to heal, from an injury. It doesn't matter if it's like a coronavirus, it could be a stroke, it could be heart attack, what have you. But just the older you are, the more stuff you come with, and the more resources your body has to deplete itself from to take care of the issue. But as far as young attacking old bodies, it's just random. We as a medical research, epidemiology community, whatever, we don't know exactly what why it affects some young and some old, or it just looks random across the board.
You spoke about how this disease, how this virus tends to make the defense systems within us overreact or overproduce and whatnot. Is that similar to what an autoimmune does, where it just attacks yourself?
Yeah,
like an
so
autoimmune?
it happens for a different reason, but and it results the same. Like an autoimmune disease is like your body loses the ability or forgets the ability to recognize itself. So it'll attack something like it could be your joints or lupus, like attacks your whole body as a whole, like different cells. But in this case, it's like it happens more with like chemo patients getting chemotherapy. Like you're already sick as it is, you have cancer or whatever, and that's a mutation problem, right? So we start introducing medications that start lowering defense systems or whatever for the body. So the body kind of just goes out of whack in a way where it just all of a sudden starts overproducing this like these proteins to attack whatever it is, because the body doesn't know what's attacking it. So it's like an overproduction, overabundance of this defense mechanism, like kind of like artillery. Sometimes you can't see the enemy, but you know where it is in the general area. It's just to start bombarding it.
Mm.
So
So this
that's what the
particular,
body does sometimes.
yeah,
Yeah.
this particular virus, I mean, they talk about where people can have it and not even know you have it. Let's just say I have it and I have no idea how. I never develop a symptom or mild symptoms. I may get like a 99.5 fever, little stuffy nose, and then a day later I'm fine and all goes away. I mean, or
Right.
something along those lines. The WHO, the World Health Organization, came out the other day. Dr. Maria Van Kerkhove, I think that's how you say her name,
Yeah.
was talking about it's very rare for asymptomatic people to transfer the disease or give the disease to other people. What exactly is asymptomatic? What does that mean?
Well, symptomatic just means no symptoms. It doesn't mean that you have have the coronavirus or not. It's very loose term. Like it's just a term thrown around a lot because the when somebody says asymptomatic, they don't mean like pre-symptomatic, which means you're not showing any symptoms and you're very contagious, and then you do show symptoms, versus not showing symptoms, you have the virus, you never showed symptoms, and then later on, oh, okay, you had the virus because there's antibodies, right?
Right.
So asymptomatic it's just like a very loose term that's widely used, sometimes incorrectly. And about that WHO report, they walked it back
They did.
a day later because they misspoke, because not enough research has been done to prove or disprove that asymptomatic, which they in that context they meant patients that have gotten the virus and currently have the virus. There's just not enough research to base a comment like that as like fact or whatever. So they had to walk back their statement because also the whole world were in a hissy fit that all of a sudden out of left field the WHO made this comment with a little research, and then they had to walk back their comments. So the WHO has been I don't know, a little irresponsible in the last few months, as far as condemning the United States as racist towards the Chinese, that kind of thing. So right now, until we have a lot more research and a lot more community, especially with the communication part of it, something as preliminary as like an initial report of asymptomatic, really hard to get, should be taken very lightly. And again, this virus is very fairly new, so I mean, we're just a lot of it is we're learning as we go along. So,
right. Yeah, the virus is very new, and obviously the world hasn't really seen this before, and the world has never really dealt with this before. Usually, when something like this happens, it's regionalized, or it's contained in some kind of region, versus it affect the entire world, which is crazy. You see coronavirus cases on a remote island you didn't even know existed, which is crazy. How did it end up there? I don't know, but we talk about how things get transmitted. What is your take on, because there has been both sides. I've read both sides of the coin on here. Some say it's right, some say it's wrong, yada, yada. What's your take on herd immunity? What is your knowledge of regarding herd immunity and how that could be good or bad for the coronavirus?
Well, herd immunity is also a very loosely used term. Herd immunity is like how we've survived as as humans without the use of vaccines. But now herd immunity is used in the context of vaccines, where we immunize all our kids against measles, mumps, rubiola, polio, that kind of thing, to where that in that context herd immunity, where we vaccinate the majority of the population, so we don't give it to the ones that are at high risk, like young children or older adults. And like the flu vaccine, for example, there's gazillions. I don't know how many flu strains there are, but we every year pharmaceutical companies try to guesstimate. I think that's how it works. Don't quote me, but they guesstimate what which are the trending viruses that for the flu. They make a serum out of it, and then we distribute the flu vaccine to the general population, the ones that can get it, herd immunity. So we don't give it to the ones that cannot get it, like chemotherapy patients, the ones that are taking autoimmune disease preventing medications, that kind of thing, or children that cannot get the vaccine. And in that context, herd immunity is is used so to prevent further disease. So in the context of coronavirus, though, we don't have a vaccine, but there's too much risk. So, because it's so unpredictable that it's not fair to say, Dan, send your grandma out and let her get immune to the disease, and we hope that she lives through it or whatever, unscathed, and that way she's immune and she doesn't have to worry about coronavirus again. So it's same thing with your children, like, send them to kindergarten, and they'll get the disease and they'll pass it, and life is good. It doesn't work that way with coronavirus because it's so unpredictable. And even kids now are getting that pediatric multi-system inflammatory syndrome, where it mimics Kawasaki disease, where it's like an overreaction of inflammatory response to your body. But it works a little bit different in pediatrics because it's not even happening like the first 14 days of contracting the virus. It's happening a little bit afterwards. So it's just so unpredictable, man.
No, I agree with you. The coronavirus has been anything but predictable, at this point. In the beginning of all this, nobody knew exactly what we were dealing with, whether on the medical side or even in the political arena or even in the economic arena. Nobody knew what we were dealing with, even from December, January, February, and up until now. Here we are in the middle of June almost, and it's been anything but predictable. When we decided to shut everything down, the NBA got canceled, all these sports people canceled, businesses had to close, states started shutting down, only keeping essential things open. Uh, it was hard. Obviously it became very hard economically. This tiny little virus that not even bacteria could see, as you said, has created this worldwide, economic, almost to as close to a grinding halt as you can get,
Yeah.
without completely going into, the dark ages here. Uh, so with that being said, we're starting to see the reopening phases. A lot of states are in phase one. Some are beginning possibly phase two. The NBA is going to start at the end of July. What is your take about, about opening back up? Because a lot of these models, we're saying, we were going to face 2.2 million deaths. Well, that was wrong, and the curve kept moving. It kept saying, okay, well, here's this curve, and it kept moving. We saw Fauci and whatnot, and I got sick of watching this, and I had to stop watching. It's like everything kept, because we weren't. I knew we weren't dealing with something we had previous presidents to really learn about. We didn't have a previous presidents to learn. So a lot of times it was kind of winging it in some sense. I think for the most part everybody was in a lot of senses. So we finally get over this proverbial curve. We're on the downward flat, and things are starting to open back up. People are starting going out and enjoying themselves. What's your take on that, and what do you want people to know as they start going back out?
Well, as far as the model is concerned, the model predicted unmitigated factors. So that meant that if we did business as usual, going out to theaters, crowded places, completely just, without any type of mitigation factors, that model was the prediction of the severity of the disease in cases and deaths. Confirmed cases is a little tricky just because as the months go by, we have more capabilities in testing, more and more supply, because the supply chain was a little bit disrupted because of this whole coronavirus, pandemic shutting down like the world, economy and production levels or whatever. But now that we're in a little better spot, not much by far, but a little better spot in testing, our confirmed cases are growing a little bit. So models predicted unmitigated factors. Okay, so the fact that we didn't meet those models and people are frustrated that, oh, how was the model wrong? People should be happy, because at the end of the day, that means that there's less deaths realized than what the model showed. And I don't understand why people are so mad that the model said this. It's like saying, oh, like I'm pissed off because not enough people died. That's or contracted the disease. To me, that boggles my mind. Okay. I'm happy that we didn't even come close to the models. Mitigations, but that's also a testament that the mitigation factors are working. The shutdown, like the overreaction of shutting down everything, shutting down the economy, shutting down, like closing businesses, non-essential. At the beginning, we just didn't know how this coronavirus was being spread and if it was airborne or not, because the capsules are so tiny. We thought at one point that they were airborne, like not unlike tuberculosis, where you're in the same room and you could contract tuberculosis. Okay, we're finding out as the months come by and the more research is coming in and confirmed. It takes a while for research to do its thing, because a company could be doing a school of medicine, a college, what have you, whatever the institution is, could be doing research, gathering data, but then it has to be peer reviewed. And that takes some time, to replicate the results. So it takes a little bit of time for all the information to start trickling in. And then, for more information to be done, more research to be done in a way where it confirms or it refutes the information that was originally posted. All that takes time. So as time goes by, we're finding out more and more about the virus, like transmission, for example. Not as much airborne, even though sometimes it does hover around the air, but it's treated more as a droplet type of transmission where it comes out of somebody's like spit or whatever when somebody is talking or shouting or breathing with humidification or whatever. So that, as we are learning that the 6-foot social distancing rule is more applicable in this case, where we could start opening up more restaurants and then things where there's more crowds, where it's not, we don't have that idea that it's like more airborne, but more droplet-based transmission. There was a CDC report a few weeks ago saying that it's more unlikely to contract the coronavirus from surfaces, like previously believed. And I think that was just a culmination of just research that it took time to collect. That we're finding out now that it's less likely to contract the virus from touching surfaces and then just rubbing your face, that kind of thing. Not that completely out of the question though, but just less likely than just person-to-person contact. So that 6-foot rule is, and that's just a loose guideline too, because we at the end of the day don't know exactly like how much time it takes, even though you're adhering to those 6 feet apart rules. Like if you're inside the same room with another person, if you're gonna get the disease or not. If let's say you're 8 feet apart, we don't know like how much time of exposure there is. But the 6-foot rule is working. And, the economy can open up responsibly in stages where they're allowing a little bit more people at a time, as long as, places are enforcing the 6-foot rule or whatever with masks. The masks are mitigating the effects of the droplet distance. So like I'm talking, if I have a mask, the droplets aren't gonna, or the capsules of protein aren't going to fly as far from my face to somebody else where they could breathe it in or whatever. So 6-foot distancing. And I think also the CDC mentioned somewhere where that was like the most important, besides, hand washing, good hygiene, one of the most important factors in limiting the spread of coronavirus.
I think one of the more frustrating parts of this whole thing, I'm speaking from from the economic side. I'm speaking from the non-medical side of things. I think one of the more frustrating things is the fact that this coronavirus takes anywhere between 8 and 12 days to even start showing symptoms because of the hibernation period in somebody. Whether that person shows symptoms or not, but if that person starts showing symptoms 8 days later, let's just say it's 8 days later on the fast end, God knows how many people that one person has been in contact with over the 8 days. That person could have children, obviously a spouse or whatnot. So that's got to be the most frustrating part. And I'm sure that's probably the more frustrating part, for you guys in the medical field and for the scientists trying to figure this out. I know they're on rush to try to, come up with some kind of vaccination or some kind of way to mitigate all this or to suppress this as much as possible so we can go about our normal daily lives, the way they were before this whole COVID thing happened. What's your thoughts on that?
Well, yeah, it's incredibly frustrating because we have to not only do things that we're not used to. Humans are social, beings. Like we work as a society because we have to socialize, right? So to be told to do something unnatural, like isolate yourself is very hard to swallow, especially uh, with something that you can't even see. So it's like you have to believe politicians, doctors, nurses, healthcare community, what have you. You have to just like believe in blind faith that you have to social isolate yourself to like be able to mitigate the spread of a disease. Is really hard to accept as a society, especially when you know that doing that is going to just, destroy a lot of small businesses and put a lot of people out of work. Because from day one, I'm pretty sure everybody knew that that was exactly what was going to happen. But it's not like something we could stop because, it's not a economically driven recession, if that's what we're calling it now. It was a medical, like a humanitarian crisis, sort of like, break in the economy.
Right.
So it's this is like one of the few times that it wasn't banks or mortgage, banks or policy that our economy grinded to a halt. It was a disease.
Right.
And that's what makes it the most frustrating. It's like something that's there, we have to deal with it, but we have no real answers to, and it's very unpredictable. So that's where the frustrations are stemming from.
Yeah,
Unfortunately,
yeah.
like we have to do stay-at-home orders. Unfortunately, we have to abide by mask wearing, 6 foot distancing until we actually have a working vaccine. Because that's the only thing that's gonna stop the spread of this disease. And unfortunately, we are gonna face a second wave because these second, third, fourth waves are created by the lockdowns. If you think about it,
Yeah.
because the whole point of doing a lockdown in the first place was not only was this thing very unpredictable, like that's the only thing that's gonna slow the spread. So the hospital system's not overburdened. That's the whole point of doing the lockdowns.
Mm-hmm.
Very unpredictable. We didn't know who got affected or who didn't. We still don't know. But anyway, to control, admissions to a hospital, so we do have survivability. Because imagine, like, if none of these mitigation factors happened, and you got sick with the coronavirus, you're gonna die in the parking lot. There's not enough like hospital beds, not enough staff. At one point, New York City, which is one of the most crowded places on earth, got especially hit because public transportation. That's like 90% of, I don't know, I'm making up a number, but that's the majority of the transportation. Like very crowded areas, especially during rush hour. I mean, I lived there for 4 months, and I've visited a million times. So very crowded. There's literally no social distancing there, especially to maintain a functioning economy there.
Mm-hmm.
So
go ahead.
No, I was just gonna say that was one of the places especially hit because it was twofold. They're a major transportation hub. There's just no social distancing there, and then on top of that, so many people got sick so fast that the hospitals were overburdened like overnight, and people were dying at their homes because they didn't want to go to the hospital, fear of transmitting the disease. When they did make it to the hospital, there was just no beds and no professionals to take care of them. And there was a fear that they were gonna run out of ventilators, a very real fear, because of just the amount of patients that were getting sick all at once. So the whole point of the mitigation, the stay-at-home mitigation factors that we had to do was, to control the hospital admission rates. Mm-hmm. So when we start opening up the country again, we're going to see another spike. It's just the way it is because, more people are going to be near each other. There's going to be another resurgence, as we're seeing now in Florida, Texas, Arkansas, North and South Carolina, and all those inner states that had less population and more isolated from a lot of transportation hubs like, Wyoming or something. North Dakota was a little different just because of, the food plants that supply the food chain around the nation. But other states are going to start seeing a research a surge in their population of coronavirus patients. So we're
I mean,
one of the stories.
the cases are going to go up because people are, are coming out of their houses. They're going to go to more places. They're going to congregate, whether they stay to 6 feet or not.
Yeah.
It's going to happen. I mean, people are like, oh my gosh, a spike in cases. Oh, let's all go back to lockdown again. Because it's going to happen. It's just like anything else. I for one, and I'm going to speak for myself, in my opinion. I remember when all this whole thing started in Florida, when everything, we're gonna close the restaurants. They can only do takeout. I mean, I was frustrated. I was so mad. I honestly thought it was overhyped. But then when I calmed down, I said, okay, we have to know what we're dealing with. We have to try to, try to stop not stop the spread. Because I don't think you're gonna ever stop the spread. I just think you're trying to slow it down to try to play catch up. And it was more of, okay, I understood that we were going to do this so that we don't overrun the hospital systems all over the country. Yeah, there's gonna be like New York,
Right.
like you said. Yeah, New York. There's certain exceptions, certain cities, but you don't want the rural hospital out in Arkansas or wherever to be overrun because a place like that may not have the capability for its population. And okay, we did so. Not nothing political here, but the administration came out with the 15-day to slow the spread. Okay, I think no matter how much we disliked it, no matter how much we didn't want the economy, because the economy was doing really well, we didn't want that to happen. But we understood that this is what we got to do to try to see how can we play catch up and get ahead of this thing. And then all of a sudden, the 15 days turns into another 15, and then another 15, another 30. We're into the May. We're into the end of May. Then phase one doesn't happen until June, and it's like people are losing their mind.
Right.
Suicide hotlines went up. People were just all over the place mentally. I think it did create a big mental how am I gonna say disease, but it's more of a big mental uh, breakdown with a lot of people because we like to be home a lot, but nobody wants to be home 24/7. And that's one of the things where like we have to open up back up. I agree, we can't just open 100% back up like it was back in February. We can't just do that, but we can't just, at this point, in my opinion, we can't just let these businesses suffer because we've lost so many businesses. So many businesses will not be open back up again. Thank God that the business I'm in was able to stay afloat, where we were able to keep our head above water, and we're starting to see it come back a little bit with jobs. But on the economic side, we couldn't stay like that any longer. No matter, is this a matter of, okay, we know enough of the virus right now. We don't know the whole story. We don't know everything, but we know enough about it to say, okay, people are already smart. Before this whole rephasing open, people were already 6 feet. People were wearing masks. I know I'm a little stubborn. I don't wear masks everywhere, but I wear it where I need to wear, where it's required. I stay 6 feet away. I follow the arrows in the public aisles. Over in the grocery store, they have the arrows.
Yeah.
I follow that. I get all that. And we have to open back up because the economy can't do it. And like I said in a previous conversation with you on Facebook, the economy is the health, and the health is the economy, in my view, because those two go hand in hand. And if the economy goes down, people start drinking. You have upticks in alcoholism and whatnot. You have upticks in drug taking, possibly. All of a sudden these people need to go to hospital for something whole differently, but these hospitals are set up for coronaviruses. And it's a delicate balance between the health system and the economic system in a lot of ways. That's the last question for this conversation. We could definitely have another conversation about this in the future because a lot of this is fascinating for me. What is your take about what I said?
Well, I mean, hospitals are still open to all services. The only thing that hospitals are not doing right now is elective surgeries, like a little Botox here. But anyway, that's outpatient. But like hold off on a knee replacement that's elective. Somebody.
Not life or death. It's not life or death.
not life or death, right?
Right.
And that's where the hospitals, generate most of the revenue anyway. Those kind of elective surgeries.
Mm-hmm.
They're still getting open heart surgeries where needed with that emergent things. What was I gonna say? I mean, it's very frustrating. Lockdowns. I don't know if states should go to the extreme to complete lockdowns like we had originally, just because of the knowledge that we have now, especially because our economy is so affected by this.
Mm-hmm.
But I
It,
see in states.
it almost seems like we should just isolate the elderly, isolate those who are affected, those who actually show symptoms, isolate those, and those like me who feel great. I feel like I did back in February. Let's all go out and because I think we've been isolated enough, and it's funny because also we go back out and we have cases go back open. Well, where'd they get it
Yeah.
from? Because people are going out even during lockdown.
Yeah, I think we just need to, and it's state by state, unfortunately, because it's
Yeah.
just the way our the United States is built, where states themselves are responsible for community needs or whatever, like in healthcare or whatever. Governors could request assistance from the federal for
Right.
more money and some resources, but ultimately it's the state's responsibility to take care of their community. So it's the state's responsibility to, and it all depends on supply also, but like develop more testing for active coronavirus infections and antibody testing too. I think that's the best start we could have, is develop those two to see, let's say Dan Thames got sick, didn't know it, is frustrated. He goes get a coronavirus swab, it's negative, and he gets an antibody, and oh crap, he had it. He was positive at one point. His body managed. He never felt anything, and now he has a coronavirus antibody. Cool. But the problem is that we need a lot more testing to be able to test how many millions of Floridians. Like what's the number now? 20 something?
Well, California has give or take 39 million. Where you're at in California has about 40 million. So Florida's a little bit less, but probably in the somewhere between 20 and 30 million, give or take. I don't know.
Something like that, right? Yeah. And California has been really, really, at least the residents have been, like double-edged sword here. Like very fortunate that California hasn't had like a huge caseload of coronavirus and mortality and morbidity and they've been very fortunate, although the economy's been in shambles in California.
Mm-hmm.
Because also it's like one of the heavily taxed states, but
it's the fourth biggest economy in the world.
Yeah, for good.
For a lot of reasons,
too,
it
but,
is. Silicon Valley, Hollywood, you name it. It for good reason it is.
But as far as the coronavirus is concerned, Californians have been very lucky because the policy here has been so aggressive in lockdowns, and just now California is opening up to more and more. They were just completely locked down up until a few weeks ago. One of the first to lock down and one of the longest to be locked down.
Yeah.
But that just is a testament of how policy has affected the curve or whatever. But in another state, and like ramping up testing or whatever for like active infection and antibody infection or antibody, excuse me, that's very important to have to start opening up the economy little by little, and it's been frustrating. That's such a complicated question, man, because it's so right. It's so unpredictable, like I said, and frustrating. And we I don't want to see I don't want to walk downtown where all the shops are closed or small mom and pop restaurants are closed. I don't want to see that. But at the same time, I don't want to see the number of deaths going up because like asymptomatic, when we use that use like term loosely, asymptomatic dad goes visits his grandma and then she gets sick and dies, even though she's been socially isolating. I don't want to see that either.
Yeah, it's
So
definitely it's a delicate balance.
it's tough, man.
It is
Yeah, and
tough. It's a
then
tough situation. It's all around. Something that hopefully if something in the future, I pray it doesn't happen again in the future or anything close to this happens. A year, 2, 3 years from now. But at least now we have something to learn from, to case study from. For us to be more aware of. That's gonna do it for this discussion here. If anybody, whoever listens to this, you have any questions, just leave them down below in the comment sections. Don't forget to subscribe to the YouTube channel. Manny, I really appreciate you taking your time. I know you probably want to get some rest after all your long shifts, man, and I hope you stay safe.
thanks a lot, Untamed.
I'll
Catch
see
you
you
on the
next month.
next one, man.
I'll see you next month, man.
Definitely, brother.
All right. Take care.
You too. Thanks. Bye.